Welcome to a St. George's University Alumni Affairs presentation. Adapting to the new normal.
Good evening. My name is Bob Ailig, and I am St. George's Vice President for Alumni Affairs, and it is a privilege for me to welcome all of you to our first ever Alumni Appreciation event. The COVID-19 pandemic has forced us to cancel many in-person alumni events and receptions over the past 3 months. Tonight's program is a chance for us to pause and reconnect and find inspiration from the thousands of SGU alumni who have been making a difference on the front lines of this global pandemic. We will also hear from students and recent graduates about how their experiences have been impacted by the pandemic. It is also a chance for us to learn about how SGU has responded to the pandemic and what our future looks like. There is no one better equipped to give us perspective on how SGU has responded and adapted over the past 3 months than our Vice Chancellor, Dr. Richard Leibowitz. I'm also very grateful that Dr. Bruce Bonanno, the President of the School of Medicine Alumni Association, will be asking questions that have been posed by you, our alumni. And now, it gives me great pleasure to introduce someone who needs no introduction, Dr. Vish Rao, St. George's beloved Dean of Students for over 4 decades. Take it away, Vish.
Good morning. I'm Dr. Rao, Dean of Students, St. George's University School of Medicine and the University. I welcome you to Grenada this morning. Many of you know me as Dean of Students and Professor of Anatomy since 1977. This morning, I thought I'll address you and welcome you to this celebration of your success as alumni of St. George's University School of Medicine from Grenada, to celebrate your success, your professional commitments, and the service you have provided to the entire humanity of the globe throughout the world. Our students and alumni come from over 80 countries in the world, from Australia to Zimbabwe. The entire globe descends upon Grenada to pursue medicine. We have experienced that with so many generations of students since 1977, that I was a part of as a professor of anatomy. And I have enjoyed my interaction with each one of you when you are a student here. My job has been extremely satisfying to me in that when you're a student, I mentor you or try to mentor you or guide you. When you become an alumnus, I have only 2 things to do. 1 is to rejoice your success. Number 2, appreciate the difference you're making in the entire globe. Traditionally, historically, St. George's University has been all-embracing of all cultures, traditions, religions, cultures from throughout the world. We have always included or made very inclusive community here, which is truly a multicultural, multiracial, multireligious community. We have shown to the rest of the world how an educational institution should truly be an international education. We are about global education to make a difference in the world. So after you graduate, my real joy is to see that you have transcended all bounds to achieve that success You have overcome all adversities in life to make a difference in somebody's life who is going through adverse experience. This pandemic, which happened to us, to the entire globe, gave an opportunity for me to celebrate your success in a true sense, because you did save lives at the front line. You risked your own life. You suffered the consequence of that. You yourself became a patient sometimes and had to sacrifice so much of your family, your profession, but yet you overcame that. That's the joy I feel deep in my heart. And today is the day to celebrate your success. At the same time, I also celebrate your family's success, your personal success in life. I cannot tell you how much I enjoy interacting with each and every student and each and every alumnus in the real life, not virtual world, but they come here, give me a hug, I give them a hug, give them a little trinket. I enjoy that. I have missed it since March 25th. It doesn't mean that we want to be disconnected. We want to be connected with you. We want to ensure that you know what's happening in Grenada. We are having a very peaceful, perfect kind of life because people are compliant and they respect the law. So we are safe here. Eventually, we'll come back to new normal. But in the meantime, I would ask you to go on the website, look at the virtual tour of Grenada. And if you happen to know a student who is coming as an alumnus here, ask them to check with us. If you happen to know any student you're sending here, ask them to check the virtual campus tour. That'll give you a three-dimensionality of this place. We are the fourth dimension, us, you, me, faculty, administration, staff. We are the fourth dimension. They'll experience that too when the new normal comes. But at least this time, engage everyone to go on virtual tour of the campus. Prospective applicants, current students, alumni will get an update firsthand. As I speak to you today, I feel as though you are in this room, and I'm expressing myself to you in a very personal, from, as we say, deep inside the heart. I celebrate your success. St. George's University takes extreme pride in your being such a diverse group. In the current pandemic situation, which has devastated the world, the racial discrimination or racial abuse must not be tolerated. It must be understood that all human beings are created equal, and we must respect each other, irrespective of their religion, caste, or color. I know St. George's University has taught cultural competency to the nth degree, and you'll apply that in your day-to-day life and set an example for future generations, your own families, your friends, and acquaintances. On my behalf, once again, I want to tell you I'm joyful, I'm proud, and I wish you the very best in life and profession. One last message I would like to give you. While you're extremely busy taking care of your patients throughout the world, you should also take care of yourself. It's important for you to be well. Pay attention to your wellness, your family's wellness, your health, your mental, emotional wellness. And if you need any tips, write to me. I'll give you free access to all wellness exercises so that you are even more successful and enjoy life to the nth degree. For what you have done up to this point, dear students and alumni, I must say, God will bless you, and may God bless you and be good. Thank you.
Welcome, I'm Dr. Bruce Bonanno, the president of the St. George's University School of Medicine Alumni Association. I'm here with Rich Leibowitz, and we have some questions that might be answered in this time of COVID, which has upset the whole world, and especially the School of Medicine. So, Rich, welcome today. And first question I have is for you is to describe St. George's initial response to protect the SGU and Grenada community from the spread of COVID-19?
Sure, Bruce. Good to be speaking with you. Of course, I would prefer we were doing this in person in New York, but as you say, COVID-19 has changed the world, and so here we are doing it virtually. So back in March, as the numbers started increasing and it became very clear that there was going to be a worldwide issue with the spread of COVID-19, we began a process led by our CEO, Andy Sussman, that really put us in the forefront of reacting quickly to what was going on in the world. First and foremost, our concern, of course, was the safety of our students, our faculty, our staff, and the people of Grenada. What we did was we worked very close in conjunction with the government of Grenada and assessed the situation on the island of Grenada. One of the things that we looked at was what was the capability of the island in terms of medical care. Now, as everybody knows, Grenada is an island of 100,000 people with a medical system that's really geared mostly to take care of those 100,000 people. One of the things that we were most concerned about was if there were a spread of disease on the island. And one has to realize that a college campus is pretty much like a cruise ship on land, that there would be a very high probability if it went through the campus that we would overwhelm the system. So the decision was made with the best interests of our students, faculty, staff, as well as the people of Grenada, to have an orderly exodus from the island of our students, faculty, and staff. Over the time since March, we've actually had 19 chartered flights that took students, families, faculty, staff back to the United States, either via Miami, through New York, and as well up to Canada and Toronto. We've been left with approximately 150 to 200 students on campus. We have been following all recommendations in terms of social distancing, closing down areas where there'd be large concentrations of people, setting people into private rooms so that there'd be a much less chance of spread, following all the local laws as they were brought out in Grenada, so that we've been left with a very, very safe campus right now. And yet, at the same time, as you know, we're able to finish the term successfully without any delay in people's progress through their medical course.
Now, it's interesting, Rich. I was down there at that time when the decision was made, having our yearly alumni conference, CME conference. And interestingly, the first day, I guess the school learned and everyone learned quickly how social media is really modeling and changing things, because somebody, I guess, sent a picture of the planes, the chartered planes all lined up on the tarmac, and it went viral, and every student basically showed up the same time, the same day. But after that first day, everything went really smoothly. Is that correct?
Yeah, I think we learned a lot. Basically, we were learning, as they say, as we were sailing the ship. So our main goal, as we said, was to successfully and safely get people off island. And we learned from the first and the second and the third charter how we could arrange it. So we became much more organized in terms of having people congregate on campus first, busing them over, how to work better with the airport authority. But I think in the end, it was actually a very, very smooth transition of moving people from campus to airport and then back to the States. And then finally, when we had our last charter, which occurred after the close of the term, things went extremely smoothly. So we'd been through hurricanes before, never through a pandemic. But now, as we joke, we know how to run SGU airlines.
And you're forgetting revolution and intervention.
Exactly. There we had a little help from the U.S. government in that one.
Yeah, I think one of the things that benefits the school is the St. George's students are very flexible in life in general. And they've made the decision to come there and to pursue their lifelong dream of becoming a physician. And I think that's part of the makeup of a St. George's student, which has probably helped.
Well, I would completely agree. I think flexibility as well as dedication would be another word that would describe the character of our students. I think the idea that people take that extra step in terms of flying down, doing their medical studies in a foreign country, and yet are able to concentrate, are able to successfully complete a term despite all that's going on around them, talk to those qualities.
And that brings us to our next point. Of course, what the school is dedicated to is the academic success and professional success of its students. How has the school supported the continuing academic success during this healthcare crisis?
Sure. So I think we very much in line with what U.S. schools had to do, very quickly transferred our teaching from in person to virtual. Now, of course, we had a head start in this because through our work with the Charter Foundation program, as well as the MSAP program, we had some previous experience in terms of doing online teaching. So in a very short period of time, with just 1 week between the time that we decided to charter our planes and get our students off island, and when we started the new curriculum, there was just that 1 week in between. And we've been able to successfully complete the term. Now, I would say that the first 2 years lend themselves much easier to a virtual environment. And that was, while not easy, somewhat of a simpler approach. Now, when you get to the clinical years, years 3 and years 4, that was a whole new world for us. And what we were able to do was to come up with a whole new solution in terms of how to teach clinical medicine. What we did was we broke each of the clinical clerkships into half units. So if your surgical clerkship was 12 weeks, we broke it down into 6 weeks of virtual and 6 weeks back in the hospitals once we're able to return in the hospitals, which I'm happy to say is right around the corner. We also developed online courses for electives, one of which was a 4-week course on COVID, very topical, obviously, that covered the epidemiology, the nature of the disease, as well as how to treat somebody when you are a provider, how to doff and don, and how to take care of universal precautions. So we were able to make that transition very, very quickly. And are continuing to look into methods that we can improve our online teaching, both from a pedagogical standpoint as well as from an interactive standpoint.
That leads us to St. George's not only concerned with the academic success, but like most people in the general population, there's a psychological effect that's happening. Has the school have any programs to help the students in their well-being, especially concerning their psychological aspects of this virus?
Well, that's a very important point, Bruce. And yes, we're very concerned about the overall wellness of our students. We've been concerned about their academics as well as their wellness for quite a while now. And we've actually had a wellness program in place. Shortly before the start of the pandemic, we actually contracted with a group out of Brooklyn that does online counseling. They'll do counseling for individuals, for couples, as well as for family counseling. And they will do this regardless of where our students are in their terms or where they are in hospitals geographically. This has been a welcome benefit. Our students have accessed this and have really taken to heart the stresses that they're under and appreciate having an avenue where they can address some of the issues that they are facing. This is something that obviously will continue after the pandemic ends. But one of the things that we're very concerned about is having our students succeed in every way, shape, and form, because we recognize that getting good grades but being emotionally in a place where one cannot provide care is not the kind of physician that we're looking to produce out of St. George's.
One of the aspects about the school that's unique is we have a very symbiotic relationship with the island of Grenada. Obviously, they're affected by this virus. And how has the school helped the island of Grenada and its people with this virus?
Sure. So we formed a very, very strong partnership over the response to COVID with the government of Grenada. We've been meeting on a weekly basis with the health minister, Mr. Nikki Steele, as well as Simon Steele, one of the senators. And basically, we have been moving every step in conjunction with them. Now, one of the things that very early on was recognized was that we would need to be doing testing on the island. Now, in the Caribbean, everybody was sending out their testing to centralized testing, which created a lot of problems because there was a 2 or 3 day delay in terms of getting results. So what we did was we had the ability to do PCR at the School of Veterinary Medicine. And Dr. Cal McPherson, at the Dean of the School of Graduate Studies, had a significant experience with viral illnesses. So working together with the government, we actually set up PCR testing for COVID through the School of Veterinary Medicine, and all the testing that was done on island was done via our lab. Then the other thing, because of our ability in the field of public health, we were able to work with the government and set up contact tracing. So we set up protocols and helped the government when the cases were discovered to go out, do the contact tracing, and create the right isolation and quarantine procedures for people who had been exposed. Finally, another area of concern was at the General Hospital in terms of the equipment that was there. Again, understanding that with COVID, one of the complications was respiratory failure, we worked with the government and provided the government with a significant number of ventilators. Previously, there was very limited ventilators there, as well as a number of other equipment, which included portable x-rays, as well as monitors. So what we did was clearly prepare the government, working with them for this pandemic, as well as providing resources for the hospital that obviously will last long beyond the pandemic.
It's great for the school to take these steps, because we as the Alumni Association should be taking a lot of these steps. But since we're still really new, having restarted the organization, we can't. So I want to laud you in the school for taking these steps. The next thing, though, is we're going to have to get our crystal ball out. And no one knows what this is going to do for us, because being in the ER, I know it changes day to day on what our new normal is. But what do you envision as the SGU's new normal in the year ahead?
Well, I think that's sort of the million-dollar question right now. What we've done, again, in conjunction with the government of Grenada, is set up how we're going to determine when it's safe to return. One of the things that we talk about, to your point, is what is the new normal? We recognize that until there is a successful vaccine and or there's treatment, we're going to need to limit the amount of students that are congregating at any point in time. So what I would anticipate is very much like in the United States, where there is gradual opening, phase 1, phase 2, phase 3, phase 4, we will, once we have met the criteria for returning to the island, we will bring people in probably, as I said, not full blast, not full 5,000 or 6,000 students, but we will have a measured return to the island. We very much want our students back on the island, and we know our students want to be there, and the people of Grenada want us to be a fully functioning school again. What we're currently doing is working on plans so that we can safely bring people back. We have not made a decision yet about August. Once again, there are criteria that need to be met, not the least of which is having commercial flights to Grenada, which have not started yet. But we're also looking at the ability to do testing, as well as to set up a campus that can socially distance and be able to fulfill all the recommendations from CDC, World Health Organization, et cetera. So I do envision a day when we will be all back in Grenada. I think the question is timing, when it'll be safe to do that. And as soon as we all believe it's safe, we will be back full force.
It's funny because one of the things you said is mentioned is vaccination. It goes back to the beginning of the school, and we used to have vaccination clinics when the school was originally formed, and all the students at the time would line up to help vaccinate the Grenadians with the everyday vaccinations we take for granted in the United States. So I think that's going to be one of the important steps going forward in the future.
Oh, I agree. I think that what we want is the campus to be safe for our students, faculty, and staff, and we want the island to be safe. We really do it's a real partnership. It's not just one of those things that's nice to put into words, but we really do feel as if we are part of the Grenadian family, and I know they treat us that way as well.
And this leads again into the next question about you having joined the school in the last couple of years, especially during this healthcare crisis. Is there things that make you really proud about the SGU alumni?
So absolutely. I think that one of the things that one has to realize is the incredible contribution that our alumni give to the U.S. healthcare system as a whole. So if you just start with numbers, the impact we have is tremendous. You know, we are number 2 in terms of the number of actively licensed physicians, and I think pretty soon we will be number 1. But I think if you go deeper, you take a look at what our graduates are doing. Now, we have graduates that run the gamut from being directors of ICUs, which obviously is where the sickest of the COVID patients wind up now. But another important thing that our graduates do is if you take a look at where a large number of our graduates wind up practicing, and you compare them to where most U.S. Graduates wind up. So we have a much higher percentage of our students that go into primary care. We have a much higher percentage, of students that go into underserved areas. Now, one of the things that we know is a risk factor for having severe COVID disease and dying of it is underlying conditions. And we know that one of the things that contribute to underlying conditions is the inability to have primary care services. So I just think about how we really span the gamut in terms of taking care of people in primary care and limiting the amount of chronic disease. And unfortunately, those that do progress and have severe disease go all the way to ICUs, and we have our graduates there as well. We also have a large number, as you know, Bruce, and I won't say this just because you're an ED doc, but emergency medicine is a very popular specialty for our students. So we're deeply embedded in the healthcare system, and I really can't imagine how it would function without SGU graduates at this point in time.
Now, having said that, some of the alumni that are going to be watching this video are going to want to know, is there any way that they can help provide support to the school in this time before they go back to full-time work, really?
Well, I think one of the things I would like to do is form a tighter relationship with the alumni and with our students who are training in their areas. So I think reaching out and having conversations between our alumni and the students who are training in hospitals that are there and sort of giving them sort of boosts of confidence, helping them understand what it's like, and really serving as a mentor would really be an important thing for them to do. Also, obviously, identifying potential students. So I think letting people know about St. George's. Look, I tell the story that up until my job prior to this, where I was president of Brooklyn Methodist Hospital, if you asked me about St. George's University, all I would have told you is that it's one of those Caribbean medical schools, and there was an intervention in 1983. But once I was president of Brooklyn Methodist Hospital, I got exposed to SGU graduates, alumni who were on staff, as well as the residents that were there. I understood then what a high quality school it was, and how the physicians that graduated from that school were supremely well prepared and dedicated in ways that I had seen at any other school I had worked at before, be it Ivy League or other. So I think really being the role model and being the mentor are huge things that our alumni can do for our current students and for our future students.
Well, Rich, I want to thank you very much for taking the time to help make this video, and hopefully as we lead into the future, St. George's has weathered a lot of changes in the past, And I think we're in good position to continue the excellence of our students and the school. And I want to thank you from the alumni for all the great help you've given us.
It's my pleasure, Bruce. Again, it's always good talking with you. I look forward to the time not only when we return to Grenada, but when we can assemble as a large group, and look forward to actually, well, I don't know if we'll be shaking hands, but at least being able to look at each other face to face. Well, thanks a lot, Bruce.
All right. Thank you, Rich.
Okay,
Bye-bye.
take care.
Good evening, everyone. How are you doing? My name is Whitney Morgan. I am a recent grad of St. George University who will be starting my family medicine residency in Memphis, Tennessee come July 1st. So first off, I want to say hello to everyone again and say thank you to the alumni. I want you all to know that I am very thankful to the alumni that came before me because you all helped to pave the way for people like me to be able to make it through. It's not easy coming from an offshore school, but you all did it. And because you all did it, we were able to do it too. This year we had over 1,000 people matching the residencies in the United States, and that is absolutely amazing. So thank you all for paving the way. Next, I'm going to tell you all about the healthcare crisis, how I think it prepared me for what's next. I think just kind of preparing me to expect the unexpected was probably one of the best things that came out of this crisis. Everything was literally pretty much turned upside down, like every bit of my world, every bit of everyone's world, like couldn't even go outside for weeks. How do you react to that? But just kind of just knowing that no matter what comes your way, just keep pushing through, and everything will, you'll come out of it. It may not be easy and it may not be ideal, but you'll eventually come out of it. And even though we're still in the midst of this crisis, we're going to come out of it, and God willing, we'll come out of it victoriously. Next, I want to talk about, how SU has prepared me to be ready for the crisis and things that come against this. Just come from SU, you're always, I'm not going to say an underdog because SU does have a pretty solid history. But, when you go into different places and you're facing up against, or coming, not going to say facing up against, but, encountering people who came from U.S. allopathic schools or even USDO schools, they kind of look at you like, you into that offshore school, but going to SU, studying Grenada, even though it's like the most beautiful place on earth, it's still different because, you're away from home, you're in this beautiful tropical place, you have to adjust and make yourself, just really study properly. And I feel like SU definitely prepared us to be able to do well in any sort of environment. So even with the pandemic going on right now, I do believe that SU has prepared us well to be able to go in any environment that we're thrown into and to be able to thrive. So I'm thankful to SU for that. But, that's it. But thank you all so much for having me. Thank you for letting me speak to you. And just thank you once again to the alumni. Thank you to SU. Thank you to Dr. Weissman, Dr. Leibowitz, Dr. Giardi, everybody, Dr. Magnifico, because you guys have been amazing. Thank you to everybody, University Support Services. Thanks to Mark, and thank y'all for having me. And thank you for listening to me. And just SU, thank you so much, because I was a very non-traditional student who had a very weird, pathway to get to medicine. SU was one of the only schools who said to me, come to us and we'll make you a doctor. And SU definitely did that. It made me an excellent doctor. It made me, I graduated cum laude, did well on all my board exams, and I had no problem matching into my number one choice residency. So thank you all for everything, and all the best to you. Goodbye.
Hi everyone, my name is Josh Ramgist. I graduated from SGU in 2011. I completed general surgery residency at Maimonides Medical Center in Brooklyn, New York, and currently I'm completing a pediatric general surgery and trauma fellowship here at the Hospital for Sick Children in Toronto, Canada. I am grateful to be part of the SGU alumni community because of the sense of identity that comes with being a St. George's graduate. My heart goes out to the many SGU students and alumni worldwide who have been putting in countless hours caring for patients in this global pandemic. Here in Toronto, my team has been adapting our trauma protocols to ensure the health and safety of both patients and the healthcare team. For a SGU graduate, having the ability to adapt to an uncertain and ever-changing scenario is almost second nature. Conservation of scarce resources while simultaneously caring for individuals across a wide socioeconomic spectrum, this is the bread and butter that an SGU graduate is used to. Our time on the island be it starting in Grenada or Newcastle, has trained us to be resilient and to overcome extraordinary adversity. These are skills which our profession needs now more than ever. As we look ahead, here in Toronto, we are looking forward to growing our SGU Regional Club. I've been fortunate to interact and work alongside many SGU graduates. We all share the same pride in what SGU has allowed us to accomplish. The tapestry of who we are started at SGU, but has now been woven into the fabric of a story which transcends many borders. I'm excited to be a St. George's graduate and consider it an honor to be your peer.
I'm grateful to our alumni for helping me through the process of applying to residency. People ask all the time, is applying to residency difficult? And the answer to that question is yes, no matter if you're an international student or an Ivy League MD student. The process is complicated and confusing, but it was made much easier by having advice of friends that graduated a year or two ahead of me. Also, whenever I went on interviews, it was always great to have an SGU grad already in the program. There was an automatic connection, and I knew that I could be a good fit there. I'm starting residency this month, and I'll be the first SGU grad in my program, so I can't wait to pass on that same guidance in future years to SGU students that I see during interview season.
Hi, I'm Brandon C. I am an attending pediatric pulmonologist and sleep specialist in Atlanta, Georgia, and I'm a member of the 2012 graduating class of the SGU's School of Medicine. I am proud to be part of the SGU Alumni Association just because I know I have a connection with many other doctors out there who've been to the same experiences as me, and we can share our experiences in current practice and be able to share the knowledge we've gained together, and also be a resource to any learners that may be working with each and every one of us to be able to broaden their network, to be able to reach out and learn as much as they can from the doctors that are part of the SGU alumni group. The current healthcare crisis definitely has affected my career here in medicine, and I think it's affected medicine in general. One, from a bad standpoint of showing us how badly we need to be better prepared for situations as we're in right now, as it comes to supplies and logistics and being able to plan for these sorts of things. It shows us the importance of being able to have a plan in place if something like this similarly happens in the future, and to have supplies in place so we can attack this, a little bit better than we did this time around. I do think that we also have been pushed towards telemedicine a little quicker than we would have previously, which actually is a good thing, I think, for me. We will not only be able to reach out to patients during this coronavirus pandemic and be able to help them, be able to stay safe and still see us at the same time, but we also will be able to reach out to those who maybe did not have access to us previously, and now will have access through the telemedicine platforms we're all learning to use very quickly. And I think that the SGU experience that I had has helped me for situations such as this to be able to be adaptable, to be able to learn kind of on the spot. I do believe that's something I was able to pick up from SGU, and also just continuing the dedication to providing healthcare to as many people as possible to help with any sort of inequalities that are in place. I do believe SGU prepared me for that, and that definitely has been useful during this, not only this pandemic, but in my career in general. Everybody have a great day. I'm glad to be able to speak to you guys here today, and just keep working hard. We're going to beat this thing.
Hi, my name is Danielle Kroll, and I am a medical oncologist, and I specialize in the treatment of breast cancer in Washington, D.C. I am grateful to be part of the SGU alumni community because I have the best friends from medical school. We have supported each other throughout residency and fellowships, and we continue to support each other now being attending physicians. The current health crisis, which we are currently facing, has definitely impacted the oncology community. This is a very difficult time to be a cancer patient. Newly diagnosed cancer patients are fearful of coming to the office out of the fear of contracting the coronavirus. Therefore, surgeries are getting delayed and chemotherapy is getting prolonged. For those patients that are currently in the hospital receiving treatment, family members are unable to come visit the sick and dying. And I worry that we have spent decades creating a very high-touch culture in oncology where we convey warmth and support and empathy for patients and caregivers, and we are really unable to deliver that during this great time of need. St. George's University graduates from all over the world are currently on the front lines in the fight against the coronavirus. Without the support of fellow graduates, this would be a very lonely time in healthcare. So thank you, SGU, for allowing me to be part of the alumni community.
Hi, Dr. Mike Hansen here. So I'm grateful to be a part of SGU alumni because I remember back when I was trying so hard to get into med school and I was hoping so badly just to get accepted. So when I finally did, I couldn't wait to get started. I told myself I was going to study hard and make the most of my time, and that's exactly what I did. In the process, I made lifelong friends, and in the end, SGU gave me the opportunity to be where I'm at today, which is practicing pulmonary and critical care medicine. The healthcare crisis with this pandemic has definitely affected me and my job in several ways. As an ICU doctor, that's where the sickest of the sickest COVID patients end up, and as if intensive care medicine wasn't hard enough before the pandemic, you can imagine how much more challenging it is now. It's forced me to become more vigilant in hand washing, to wearing more PPE more often, to having to think outside the box when it comes to limited visitors in the ICU and the communication among family members who can't be there due to the visitation policy. It's also impacted me in the pulmonary clinic because I have a lot more telemedicine visits and less in-person visits, and there's pros and cons to both of those things. I would say that the biggest positive impact I've been able to have is actually through my YouTube channel, Dr. Mike Hansen. This is where I'm able to provide public education during the pandemic. There are so many people who are grateful to have all the nuances of COVID explained to them so they can learn and understand what is going on. And no question, it's been SGU that's allowed me to be able to do what I'm doing today. So that I'm grateful for.
Hi, my name is Giovanna Verdi, and I am starting my third year as a medical student at St. George's University, and I am from Long Island, New York. I am grateful to our SGU alumni because they have been setting a great example for us soon-to-be physicians. Continuously and every single day, they are still fighting against the COVID-19 pandemic, and they are still bringing smiles to our patients and our communities. Thanks to this healthcare crisis, I feel more prepared for my future career because I've been able to adapt to quick and sudden changes, specifically shifting from an in-person learning experience at our campus in Grenada to an online and distance learning platform at home. And this was definitely a challenge in the very beginning. However, us physicians need to understand that things can happen at any time during a patient's disease or during their course of treatment at a hospital. So we need to act accordingly based on that to save our patients' lives. SGU has prepared me to care for the patient first, then the disease. With SGU's emphasis on team-based learning, we will be the physicians that will have shared decision-making with our patients. And my motto is, happy patient, happy life.
I'm incredibly proud about the response that we've had as a specialty and as a profession. We were called to perform above and beyond what we ever expected to do in our career. And so having that feeling or that mindset, you show up to work and instantly you're thrown into a team, you're a family. Showing up to a shift and seeing your team, seeing the family that you're working with today, you develop bonds in a relationship that it's really hard to describe. as I mentioned earlier, it's kind of like going into battle together. You're in this event, you're in the trenches together, and it really shows our resolve and how strong we can be when we're working together as a family or as a team. As an emergency physician in this time period, we're faced with this historic event, and it's an incredibly thrilling but chilling experience at the same time. It's a marathon. From a disaster perspective, I would say most disasters occur and immediately we'll enter a phase of recovery, and operations are designed to return to normal. A pandemic like COVID-19, it's not like that. So, the analogy is that it's like a marathon. You can't necessarily think about when the end is.
Hi, my name is Sumit Ball. I am a vascular and interventional radiologist at the Brooklyn Hospital Center, where a lot of you have done your clinical training or will do it for your clinical rotations. So looking forward to having you when you do come through. I graduated from St. George's in 2013. I did all of my residency and fellowship training in the Mount Sinai Health System, so it's nice to stay in New York City and actually come back to where all of my career really started. I am dealing with COVID patients on a regular basis, some of it from the standpoint of just patients who are very susceptible to it. So basically cancer patients. We do a lot of biopsies, ablations of tumors, embolizations, where we're basically blocking the blood supply to those tumors. So you can imagine these patients are on heavy duty chemotherapy and are at risk for coming into the hospital. Now we're seeing more of the complications of the disease long term. So patients in kidney failure who are requiring a lot of tunnel dialysis catheters, where we have to work directly from their neck, and we're very close to their face, of course, as we're putting those catheters in. Another thing we're seeing a lot of is blood clots that are going to the patient's lungs. So if the blood thinners alone are not doing the job, we actually go into the pulmonary arteries and bust up the clots with TPA, and we can actually suck out the clot. So it's a really fantastic field that we're in, and I hope a lot of you from watching this video and what you've heard about vascular and interventional radiology are inspired to go into it. One thing I want to say for all of the people who are hopefuls for going into this field or trying to figure out what you want to do, IR is a pretty awesome place to be. We really are the wave of the future, and our school definitely gives the opportunity to do it. You got to work hard, but you can make it. I'm one of those success stories who can make it into a very competitive but very exciting field who is on the front lines of COVID care. Everyone stay safe out there. Thanks.
Hello, everyone. My name is Brett Mauser, Managing Editor at St. George's University, and today we are joined by Dr. Justin Roberts, Chief Anesthesiology Resident at Robert Wood Johnson Medical School in New Jersey. Dr.
Yes.
Roberts, thank you for joining us.
Thanks for having me.
Dr. Roberts is on the front lines as the COVID pandemic is going on. We're going to check in with him and see how things are going. So, Dr. Roberts, how would you describe what you and your hospital have been through over the past few days and weeks?
So, the past few days and weeks, I guess, have brought a lot of, I guess the best way to describe it is change. The only thing that has been consistent about this whole thing has been, change in the way that we're providing care for these patients, providing new locations for intensive care units, trying to delineate, what units are going to be COVID units, what units are going to be, exempt from those COVID patients, and kind of protect their own, comorbidities that are existing and not add to them. So from like a system standpoint, that's kind of what we're dealing with. We've made a lot of changes during this time, and like I said, for the locations of the patients, but also kind of the role within we're trying to treat these people. So there's a lot of stress going on in the hospital. A lot of people are, experiencing a lot of those stressors, both at home and the fear of the unknown. So everybody's really trying to work together during this time. One of the nice things to see is different, lines of care, cardiology, interventional radiology, anesthesiology, all these different lines kind of coming together and really trying to help people.
Is it a situation, you'd mentioned it before, but is it a situation where coronavirus patients are making up most or all of the caseload in the hospital, or is there a lot of business as usual going on?
So, in terms of business as usual, so from an anesthesiology perspective, we staff many locations during the day. So we staff our general OR, and then we also are staffing places like cath lab, endoscopy, interventional radiology, things like that. So there's a lot of different locations that we do staff. We're definitely trying to, I mean, from a state mandate, there's all non-essential procedures are being canceled. So we're definitely looking at those cases on a day-by-day basis, and administration is kind of deciding, what cases need to go, what cases should wait until it's a safer time for the patient. So at this time, we're really trying to be very patient-centric. So business as usual is definitely not the case. We're not doing a lot of cases that are quote unquote the elective cases. We're not doing those right now. There's been a complete halt to those, and only the cases that need to go, whether it be, time sensitive surgery for anybody with, large tumor burden, cancer procedures, or any sort of traumas that come through the door, only those urgent cases are going to the OR. So business as usual is definitely not the case, like I said. In terms of the patient population that we're treating, we're definitely, those patients who have COVID also are going to need surgery. So one of the things that we're doing is, trying to implement plans and make sure that these patients who do have COVID are going for procedures and, going to and through them safely. And that's not only the patient, but making sure that all the support staff, from nursing to the surgeons to the anesthesiologists, making sure that everybody is doing this safely, is vital.
It's been pegged as a virus that has largely affected older patients. Have you found that to be the case, or are there some other patients who are coming in that you've seen?
Oh no, there's patients for all age ranges. We're definitely seeing kind of a smattering be across all age ranges. Of course, you do always, you hear, okay, if, you're elderly or if you have multiple comorbidities, that you're more prone to, getting the disease. I think we look at the process like, if you get the disease, if you get, the COVID virus, how that's going to affect you. We see people who are just, getting a small, mild fever and then cough, and then that's kind of it. And then you talk to people who get it and they say, I felt horrible for, 7 days, all the way up to, the patient who comes in severe respiratory distress, goes into, acute respiratory failure, and then requires, intervention, requires intubation, to put on mechanical ventilation, all through the different kind of modalities that we're using to treat these people. So they're having comorbidities is not going to, say, okay, you're going to get this disease, but it definitely doesn't help. We always read about, diabetes, hypertension, any sort of existing respiratory diseases that you have. So these comorbidities don't necessarily help you, but it's not necessarily saying if you get this, that it's going to affect you like this. A lot of the information that we're getting is always new, so as we go through this, everybody's kind of going through this together. We're always getting new information on medications to use, how the disease process is evolving. So all this is an ongoing process. But to say that one patient population is being affected more than the other, I think is really institutional dependent. And I think we're really going to have to wait for all of that data to come in later.
Welcome. My name is Bob Ryan. I'm the Dean of Admissions here at the university. I've had the privilege of working here for over 25 years now, and I'm sure I've met many of you as you've gone through the application process while students on either Grenada or the UK campus, or as a graduate assisting the Office of Admissions on our many outreaches to students and parents. In my 25 years, I've had the pleasure of visiting over 40 different countries on behalf of the university, and have met mainly with students and parents, but also hospitals, governments, and academic institutions. So I'm very proud of what I've been able to accomplish here with the work of the rest of the admissions office and, of course, the administration of the university. I want to just introduce tonight a brand new program that we're rolling out called the Alumni Referral Program. And what this will allow you to do is if you refer a student before they apply to the university to my office, and we'll get into details later, that student can receive up to a $20,000 alumni grant and is still eligible for the academic, humanitarian, and other grants and scholarships that we award students on a regular basis. It'll be a simple WUFU form that you would be able to get to the link, and the link will be in the upcoming newsletter, so that'll allow you to recommend students to St. George's. The Office of Admissions really appreciates when graduates and alum take the time to send in a letter of recommendation, and now as a further incentive for the student, if you fill out this form, he or she will receive that up to, as I said, up to a $20,000 grant. On a personal note, I always like to make reference to the fact that in a few years, I will be the grandfather of an SGU alum. My own granddaughter is in year 1 of the veterinary school. She had to do 3 years of pre-vet, and I mention that because she did those in Grenada, and like myself, has totally fallen in love with Grenada. Not only the campus and the students and faculty at SGU, but the people and the friendliness that she encounters throughout the island. So a couple more years, I'll be joining the parents of students and alums, but I'm not myself a graduate. So having said all that, I want to thank all of you out there on the front lines during this pandemic, helping the patients, helping the doctors and nurses, working as teams, and hopefully the end will be soon for this pandemic. All the best, and thank you again.
I am sure you will all join me in thanking our alumni and students for sharing their stories of making a difference over the past several very difficult, unsettling months. It is impossible not to be inspired by these stories and look forward to the future with optimism as we all adapt to a new normal. As we look forward, my colleagues and I in Alumni Affairs and across the entire St. George's University community understand that connecting with and engaging our global SGU alumni family is vital to our momentum. Our alumni play a vital role in raising SGU's visibility, recruiting prospective students, and providing a pathway to residencies and broader medical career mentoring. We will build from the success of tonight's virtual programming, build on our opportunities to meet in person in the future. If we have learned anything from this global pandemic, it's that we're all in this together. If you have suggestions for how we might strengthen our alumni outreach and engagement, please contact us at alumnirelationsoffice@sgu.edu. Again, that's alumnirelationsoffice@sgu.edu. I would like to close with a heartfelt thank you to all our alumni who participated this evening, especially those who shared their stories and experiences with us. We have learned from you and been inspired by you. I would also like to thank my SG colleagues across the university who worked tirelessly to make this first ever Alumni Appreciation event possible. Have a great night, and thanks again for joining us.
From all our faculty, staff, and students at St. George's University, thank you for being a part of our community